Hi, everybody. My name's Hussain Rao. I'm a MedSchoolCoach tutor. I tutor both USMLE Step 1 and Step 2. I've been with them for about a year now, and so this is going to be our question of the week this week, and let's get started. So I'll start by just reading through the question, and then we'll take a look at the answer choices. So a 54-year-old woman comes to the clinic today due to difficulty with her profession as a home painter. She says that she has been having increased difficulty reaching above her head to paint ceilings. She reports worsening weakness of her arms and legs. She also complains of a rash that has been spreading over her cheeks and the back of her hands. Physical exam reveals difficulty lifting her arms above her head and standing up from a seated position. Examination of the hands revealed the following findings. So we see the rash over here on the hand. What is the patient at greatest risk for in the future? So I'll go ahead and give you a chance to pause the video now and think about an answer to this question and take your time to think about it. All right, welcome back. We'll start going to the answer choices now, and we'll start from A, go to E, and kind of work through what they're getting after and what each answer choice is referring to. So in summation, this is a 54-year-old woman that's coming into clinic. It seems like she has some proximal muscle weakness based on the fact that she's having difficulty reaching above her head using her shoulder muscles, as well as difficulty standing up from a seated position using her proximal quadricep muscles. It also seems like she has this rash that's both on her cheeks as well as the back of her hands. So with those two things together, we're kind of expected to piece together a diagnosis here because the answer choice is asking about what she's at the risk for, what she's at greatest risk for in the future. So for answer choice A, renal failure, we'll have to evaluate kind of what each answer choice is getting after, since these are kind of secondary options. As in, first we need to come up with a diagnosis and then think about what they would be at risk for. So in this question, renal failure isn't really getting at the correct diagnosis because more than likely this is put in there as a reference to lupus. And lupus might be thought of in this question because of the rash in her cheeks, but because this is the only symptom that's representative of lupus and it doesn't really fit the picture of the rash in her hands that we have here, as well as her proximal muscle weakness, we can effectively rule this one out. So spontaneous abortions. The increase in spontaneous abortion risk is probably referring to antiphospholipid syndrome. And again, both the proximal muscle weakness and the rash that we see here is not very characteristic of what we'd expect for antiphospholipid antibody syndrome. And we would also kind of expect some of the lupus-like characteristics and that kind of presentation for it to be going down the track of antiphospholipid syndrome. So then we have central retinal artery occlusion. So central retinal artery occlusion is a risk for people who have giant temporal cell arteritis. Now, these patients typically have symptoms such as jaw pain when chewing, secondary to claudication, as well as blindness or sudden onset blindness from central retinal artery occlusion. However, they can present with proximal muscle weakness, which is somewhat similar to the vignette we have here. And that's due to the association with giant cell temporal arteritis and its association with polymyalgia rheumatica. So although that's associated with proximal muscle weakness, it doesn't really quite fit the picture of a rash, and it's kind of a stretch in this case to go for that answer. So next we have depression. In this case, depression is likely referring to fibromyalgia, as that's a common comorbidity that occurs with fibromyalgia. And for fibromyalgia patients, we typically see tender spots throughout the body in multiple different areas. And this is not necessarily associated with the proximal muscle weakness that we see here, as well as the rash. So we're finally left with visceral malignancy. This is the correct answer. And what this question is getting after is this combination of proximal muscle weakness, as well as the skin findings, are very characteristic for the diagnosis of dermatomyositis. So in dermatomyositis, we can see this rash in the hands, and these rash areas are referred to as Grotton's papules, which is a very high yield association. The proximal muscle weakness is also associated with dermatomyositis, as the name suggests, dermatomyositis, so involving both the skin as well as the muscles. And these patients are characteristically at a higher risk for visceral malignancy. as dermatomyositis can present as part of a paraneoplastic syndrome. So with that in mind, let's get into the details of the explanation of this question. And as we said previously, this patient has dermatomyositis, and kind of the combination of the proximal muscle weakness, as well as that characteristic rash, the Grotton's papules, are kind of pieced together our diagnosis here. Now, interestingly, this rash, this vignette also mentions a rash on our cheeks. So one thing to keep in mind is that this butterfly or malar rash is commonly known as the rash for lupus, but can also present in some other conditions such as dermatomyositis. And in that question stem, because there weren't any, significant risk factors or significant clues pointing us down in the direction of lupus, and especially with the combination of the proximal muscle weakness, dermatomyositis was a better answer here. So patients with dermatomyositis, like I mentioned, have an increased risk of developing cancer. And the greatest risk is seen within the first year following the diagnosis. However, it may be seen before or after the diagnosis. And this is because of its relationship as being part of paraneoplastic syndrome. So the differential diagnosis here includes polymyalgia rheumatica, like we talked about in association with giant cell temporal arteritis, myasthenia gravis, and miscellaneous musculoskeletal pathology. So a big takeaway from this question of the week and this vignette was understanding both proximal muscle weakness and kind of breaking it down and understanding that dermatomyositis has that characteristic rash on the hands, as well as the high yield association with the potential association with the paraneoplastic syndrome. And so this secondary risk of visceral malignancy ends up being very high yield for USMLE Step 1 questions. So thank you all for tuning in, and I hope that you were able to learn something today.